that's where we talk about something called benefit, right? And essentially, we see the issue of short-term trips as not the trips themselves, but the fact that they're not being done responsibly and not being done right. If we look at the benefits, though, we should ask who benefits, how do they benefit, and why, and understand that all as part of the nature of short-term medical experiences abroad. So, let's think about outcomes, right? In terms of outcomes, are they all bad? Like, basically, are these just horrible, horrible things that they should never be done? Well, we know that there are benefits for the volunteers. We also know that there are benefits for the institutions. And we also know that there are benefits for the community abroad as well. Now, that said, we also know the big issue is that there are harms for the community abroad, the people that are purportedly being served. That said, there are also harms and risks for the volunteers and institutions, but that's not really the focus of this talk, given that most of the opposition and controversy to short-term trips is the fact that they come across as self-serving and effective, all those other things that we mentioned earlier, right? But let's just quickly review. Everyone knows about the volunteer benefits. I don't really need to go through them extensively, but literature has shown that volunteers who go abroad, they're able to receive exposure to rarer conditions that they may not have seen at home. They get skills development, mentorship. It helps with their career choices. They tend to choose more underserved specialties, things like that. They develop networking and connections with other team members, with people abroad. So there are clear benefits for volunteers, right? There are also clear benefits for organizations and institutions. Institutions nowadays, literature shows that they basically want global health as a big part of what they do and what they offer because it attracts faculty, it attracts students. Apparently students, 65% of medical students surveyed in the United States in 2011 expected at one point or another that they would go abroad on some sort of short-term educational experience. So organizations benefit because it attracts students, it attracts faculty, it attracts funding. So these efforts are another thing. And then it's a little less clear when it comes to the community abroad, when it comes to populations abroad that receive these trips. And that's why I put this little rain-splattered windshield, because it's not really clear. It's more a muddled picture of what they get out of it, right? I mean, typically when we're talking about medical care, if you're going there to provide medical care, you're essentially providing downstream care, right? They also establish professional contacts with people abroad who could potentially, which could potentially lead somewhere. But more about that, in terms of that, there's harms, right? So the receiving community, typically they devote their very limited resources to host these trips. There's a power differential, obviously. There's cultural incongruence. The issue of lack of follow-up and adverse events are sort of linked together, right? For example, if you give a bunch of Tylenol and let's say someone goes into liver failure because they took it all at once, what are you doing, kind of thing. It also enforces a colonial kind of mentality. So these are all sort of the harms that are that people are most concerned about when it comes to short-term trips. So essentially the issue is if you're ready to go, if you're ready to launch, what are you thinking about when you come to short-term trips? We go back to the question, are trips all bad? Is it all bad news? Or is it more that in their current form, the trips do not adequately benefit the community abroad? And if the latter question is the one that we're concerned about, because I think the first question is more of a rhetorical one, it's obvious that there are benefits. We've already described there's reasons why people are going to go. So if we're considering the second question, what are the alternatives? Do we just throw up our hands and say, we can't really do anything about it, or do we try to find alternatives? And so, what we talk about at the 53rd week is the balance of benefits, right? This is the current situation. So basically, you've got the receiving community abroad, which is bearing a lot of the burdens and the harms that are associated with these trips, and minimal to not really substantial benefit. And then you have the volunteers and institutions who are being kind of propped up. So the benefit right now, when we talk about the balance of benefits for short-term volunteerism, it basically heavily favors the volunteers and institutions, and the receiving community abroad, the receiving populations abroad receive very scant benefit from them. So if the issue is the balance of benefits, though, is there a way we can make these trips better such that they're able to actually, benefit the community abroad in a specific way?